Have you ever felt an unexpected ache in your bones or noticed a new bump that just wasn't there before? It's natural to wonder what might be causing these changes and to hope for the best. When it comes to identifying benign bone tumors, doctors relying on a systematic approach that primarily involves various imaging techniques. These methods include standard X-rays, magnetic resonance imaging, commonly known as MRI scans, and computed tomography, or CT scans. In some cases, a bone scan might also be used, with a biopsy providing the definitive diagnosis. Each imaging method plays a unique role in building a clear picture of the bone growth. X-rays are usually the first step because they are excellent at showing the basic structure of the bone, including any calcification, the margins of the growth, and its overall pattern. This initial view helps to suggest whether a lesion is more likely benign or potentially something more concerning. For a deeper look, MRI scans are invaluable. They provide detailed images of soft tissues, bone marrow changes, and the precise size and location of the tumor, helping distinguish benign features from those that might indicate a malignant condition. CT scans, on the other hand, are superior for evaluating intricate bony details, cortical integrity, and the anatomy of complex areas like the spine or pelvis. This array of imaging allows specialists to gather comprehensive information about the growth without invasive procedures. If you experience persistent bone pain or discover a noticeable mass, the process typically begins with a visit to your doctor. They will start with a physical examination and a thorough review of your medical history. Following this, imaging tests will be ordered, usually beginning with an X-ray. If the X-ray raises questions or requires more detail, your doctor may then recommend an MRI or CT scan. Should there still be any doubt after these imaging studies, a specialist may perform a biopsy, which involves taking a small tissue sample for microscopic examination. This final step is the gold standard for confirming whether a tumor is benign or malignant. A fascinating detail doctors look for in X-rays is what's called the zone of transition. A sharp, well-defined border around a bone lesion often suggests a benign growth, indicating that it's pushing existing tissue aside. Conversely, an ill-defined or wide zone might raise more concern. It's also important to know that while a bone scan shows metabolic activity and can highlight a hot area, this doesn't automatically mean cancer. Benign conditions like fractures or arthritis also show increased uptake. That's why the expertise of a musculoskeletal radiologist or oncologist, specialists in bone conditions, is crucial for accurate interpretation. Understanding the various methods used to identify benign bone tumors empowers you with knowledge and helps alleviate worry. A systematic and thorough diagnostic approach, guided by your healthcare team, ensures that any bone growth is accurately identified. This clarity allows for the right course of action, whether it's simply monitoring a benign condition or pursuing further treatment, ultimately bringing you peace of mind and supporting your journey to bone health.